Hi, I'm Dr. Jim Hoven at Ramos Law, your host for Health Matters. Today, we're going to spend a few minutes talking about a really big pain in the wrist known as carpal tunnel syndrome. We're going to get after that next, and hopefully you're going to learn some stuff to help you feel better really fast. If you've ever had a trauma to your wrist, whether it's, let's say you're in a car accident and your wrist jams up or you slip and fall, or you've been working a lot on a computer called microtrauma, any one of those things can cause what's in the short term called CTS. But if we break that out, it means carpal tunnel syndrome. And what happens in carpal tunnel syndrome is that we have right inside of our wrist here, there's a bunch of tendons that go through a tunnel that is surrounded by the wrist bones. And that tunnel then has, it's called a retinaculum, or a piece of fibrous tendon that goes over the top of it. And when that tendon gets swollen from all of the muscle injuries that can take place from the things we talked about earlier, it can cause a decrease in the space of the tunnel. And when that space decreases, what we find is that there's a nerve in there that will get pinched. And when that nerve gets pinched because of the swelling, it goes into typically the thumb and then part of this first finger here. So it looks something like this. So if you've experienced that, it's really painful, and there's some things that you can do to treat it. So we want to take care of that today. And the reason I'm bringing it up on this episode is because we take care of so many people that have been in some sort of traumatic event that will see that, and sometimes they forget to report it to their doctors because they're thinking of neck pain or headaches or back pain. But we want to talk about every kind of pain that might be trauma-based. So if you get carpal tunnel or CTS, the first thing you want to do is make sure that you take relief off of the stressed tissues. In other words, the muscles and tendons. And so that's going to be, it can be done in lots of ways, but one of the ways is to reduce the activity that's stressing it. So if you got it from a trauma, but now it's being worsened by typing or mousing, then we're going to want to restrict those activities, or look at putting a simple brace on, or even it gets simpler than that. We could take a piece of electrical tape, put the palm in this position so it's curled up, put the electrical tape or some kind of tape around that so that your hand can't open, because the tunnel is going to shallow out when we extend and open our hand like that. So one easy way to take that off, and you got to be careful if you put any tape on, by the way, make sure you don't have any reactions to the adhesives. That's really important. That's a great kind of self-help thing that you can do. And if that starts to work, that means you should get in to see someone to evaluate what structures, what muscles, what tendons are irritating that nerve. So the other thing that you can do is when you go to one of your providers, what you'll often find is that they'll stretch some of the muscles gently, depending on how acute and how severe this is. They'll put some tension and relax some of the muscles in here, and also open up through the tunnel both ways, increasing the opening as we go back and forth in the wrist. Typically, we can also use things like acupuncture, chiropractic to mobilize around the tunnel. There can sometimes be even a neck component that goes with it. So looking at the thing from the very top of the nerve supply, which is at the neck part of your spine, all the way down to the shoulder, elbow, and into the wrist, that's going to be a comprehensive way. Now, there's always some medication if the conservative treatment doesn't work. Medication helps with some of the swelling, the anti-inflammatory things, and the pain control. And in a worst case scenario, they can do a surgery. I'm not a big fan of that unless all other things have been exhausted. And that surgery is where they actually take that fibrous band called the retinaculum, and they would cut that so that then you would have that space opening where that band wasn't the roof of the tunnel getting smashed. The problem with that is if you don't eliminate the stressor, then you're going to have that whole thing come over again. But now after the cut, you're going to have scar tissue in there, which doesn't heal nicely. So it can lead to repeat conditions of CTS. So I hope that gives you some information on not only what carpal tunnel or CTS is, but how to treat it. Of course, if you have any questions, feel free to reach out to me directly at jim@ramoslaw.com. And until next time, remember, your health matters.